Good evening, everybody. Welcome, and thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate with a new haircut. Anyway, we're going to have a very exciting program. We're going to talk about drugs today. So drugs are the big topic because there are two new drugs that have been recently released and approved by the Federal Drug Administration. So let me first say something about drugs. I am, as you know, I'm an integrative cardiologist practicing functional medicine. So, of course, I'm very big on lifestyle. Lifestyle means nutrition, exercise, stress management, sleep. Those are all very important, but we can't ignore the role of pharmaceuticals in this country. Despite what you may think about big pharma and the expense and blah, 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 drugs have played a big role in all of our lives for decades now. Whether it's antibiotics, insulin, or cardiac drugs. In my field alone, in cardiology, drugs have played a big role because the proper medication can actually ameliorate symptoms. They can decrease the number of hospitalizations a patient has. And more important, it can actually increase survival and lessen mortality. So there's definitely a role for meds. That said, let's talk about the two medications that were just recently released last month. Now, the first drug is, the first one is the weight loss drug. The first is the weight loss drug, and the second drug is an Alzheimer's drug. So let's talk about the weight loss drug, because everybody's interested in weight loss, right? So the first drug is called Wegovy. That's WEGOVY. And the generic is semaglutide, and it's from a company called Novo Nordisk. And it's a GLP-1 receptor agonist. So what does that mean? It's a glucagon-like peptide receptor agonist, which is it's actually mimicking a true hormone that we all have in our bodies, in our guts, called GLP. And its role is to give us a sense of fullness and decrease the emptying from the stomach so that we eat less, which of course is very useful for most of us, and certainly the diabetic. Now, it's not a new drug. Well, this has been around for a while. It's under a different name called Ozempic. As opposed to Wegovy, it's under a name called Ozempic, which I've been using for a few years now. And it's very useful in diabetic patients. It's administered once a week, subcutaneously, in lower doses, and actually can improve glycemic control in diabetes and also produce weight loss. And that probably was the impetus behind coming out with a different form of the same drug. So in diabetes, we start really slow, 0.25, then we go to 0.5, then we go to 1 milligram. And that's injected subcutaneously on a weekly basis. Now, with Wegovy, it's a little bit different. We still start very slow, and I'll tell you why, but we go up to 2.5 milligrams, okay? 2.5 milligrams, 2.4 milligrams, and it's given once a week. So how did this, and it works because of this sense of fullness that we get, and it reduces hunger. So, now, this decision was made on 3 different trials I think of about 4,500 patients, so a lot of patients, and they randomized these patients to one got the Wegovy and lifestyle, one just got lifestyle. And by the way, lifestyle was supposed to be a low-calorie diet. That's all I really know, a low-calorie diet coupled with exercise. But they show that the ones that received the Wegovy or the semaglutide actually had a significant weight loss of like 15 to 18% over a period of 68 weeks. It's over a year. Now, how does that compare to other weight loss drugs? Your typical weight loss drug that's been used in the past maybe gave you a 10% weight loss. So let's say you're 200 pounds and you lost 10%, then you would lose 20 pounds. But now this is quite a game changer in itself. So according to the studies, like up to 15 to 18% weight loss is pretty good. So what are the drawbacks? Okay, so it sounds really good, right? Well, one drawback is that there's a lot of GI effects. Okay, the most common is fullness, nausea. That's why you have to start really, really slow. Even with Ozempic, which I've been using for a few years now, we have to start really low because of the GI effects, which I'll elaborate on in a minute. And the cost, we're talking about $1,350 a month. And I don't think insurance is going to cover it, do you? I doubt it. That's $1,350 out of pocket, which is going to be pretty expensive. And again, it has to be injected subcutaneously, so you have to be not needle phobic. Now, just to go over the exact symptoms, the adverse effects. Nausea is seen in 44%. That's the most common side effect. Diarrhea, 30%. Vomiting, 24%. Constipation, 24%. Stomach pain, 20%. These are like not cool, right? So I would be very hesitant to give these drugs to anyone with a gut-related problem, irritable bowel syndrome, any kind of gut-related problem. And gut health is really important these days. Not if you've heard it from me and from other people, that your gut is really your second brain. So if your gut's not healthy, you're not healthy. So before you would ever consider using a drug like this on patients that have dysbiosis or leaky gut, irritable bowel, small intestinal bowel overgrowth, you really have to correct the gut first, really heal the gut before you would ever consider giving something like this. And even then, I would be very suspect about using a drug like this with so many GI side effects. Now, what's my view about it? I think overall, it could be a game changer. One thing I like about it is that it actually works on the gut versus the brain. If you look at some of the earlier weight loss drugs, it really worked on the brain. And it stimulated neurotransmitters, and it's very complicated how they work. This is really working on the gut. The gut is telling the brain what to do versus the brain telling the gut what to do. So that's a little bit of a change. And I do think, like any, I mean, weight loss is a big deal. 42% of the American population is obese and 70% is overweight. This is like not good. And so if we could put a damper on that, that would be a very good start. And there's also all the attendant diseases that we see with obesity: hypertension, high cholesterol, cancer, fatty liver disease, polycystic ovarian syndrome. These are all associated with obesity and being overweight. So, and also the other thing, a practical aspect is the workforce. I mean, if you look at the studies, absenteeism from the obese population is much greater than in people that are of normal size. They take more sick days and their productivity is less. And this has been shown to be in multiple studies. So it's not a miracle drug in my estimation, but it could play a good role as an adjunct. But again, they don't really talk, they just say low calorie diet and exercise. So we have to really define what's going to be the exercise program, and most important, what's going to be a low calorie diet. Is it a low carb diet? Is it a low fat diet? None of that was really mentioned. So you still will have to work carefully with a nutritionist and or functional medicine team that really is into diet to have this drug work effectively. But there could be a role, so I'm not against it. Okay, second drug. This one is I can't even pronounce it, all right? It's called ADUHELM. That's ADUHELM. And it stands for that's the generic is aducanumab. Aducanumab. Okay, that's a biologic. It's a monoclonal antibody by a company called Biogen. And monoclonal antibodies have their role. You know, they've been useful in treating COVID patients. They've been used in various cancer immunotherapies and so forth. So here we're using a medication, a monoclonal antibody, to attack amyloid plaque in the brain to see if we can certainly improve the state of patients with Alzheimer's disease. It's one dose. It's 170 milligrams. It's given intravenously in the doctor's office on a monthly basis. And so it actually binds to the amyloid plaque. Now, let's talk a bit about amyloid plaque. Amyloid plaque, the question is what's the chicken and what's the egg here? And that's very important because we know that all forms of neurodegenerative disease start off with inflammation. The brain's on fire, just like the coronary arteries are on fire when you're talking about inflammation of the coronaries. And what happens is that inflammation begins and then plaque forms. So is plaque part of forming a scar? Is it actually, in keeping the injury in one area versus spreading it? So we're not quite sure. They do know for a fact that we have found amyloid plaque in the brains of elderly people without dementia, without Alzheimer's. It could be a part of aging. So this whole thing about where the role of in plaque and kind of melting the plaque and sticking to the plaque, whether that's really the thing that it's helpful. So how did this even get approved to begin with? Okay, there's two trials, the Emerge and the Engage trial, and they were terminated. They were terminated last year in January in 2020 because they didn't outperform placebo. Hello, Placebo did just as well as these drugs, yet they were not approved. And then in November of 2020, the FDA flatly said no, forget it. But then there was a battle between Biogen and the FDA, and I don't really know what happened because this is all political stuff that we're not really privy to. And then all of a sudden, in June, it gets approved. It was fast tracked. And the head of the FDA says this is a good thing. And now you have to remember that approval of an FDA drug assumes but doesn't prove clinical benefit. So we assume it's going to be clinically efficacious, but we don't really know that for sure, right? And so the FDA basically felt very pressured by Biogen to get this thing passed. But let me tell you, there's a lot of controversy already on this drug because now they're employing an independent team of specialists to see, is this really valid? Is this really the right thing to do? So it is available, but there's so much controversy that I don't really know what direction it's going, but I'm very suspect about it. And again, it's a cost issue. It's very expensive. Right now, I can tell you for sure that Medicare is not going to Medicare has already said we're not interested in this. A lot of the PPOs, private insurance, we're not interested. They are not pleased with the data that we've seen. So it doesn't look like a go at this point. So it's kind of exciting to see what's going to happen, but I kind of like controversy, and this is very controversial. The weight loss drug, I think, will play a role in a small population of people. But again, if we don't get people involved with lifestyle management, it's just going to be another weight loss drug. People are always looking for that magic bullet, that magic pill, that magic vaccine. And the magic comes from within. It's what we do in our lifestyle. So with that said, I'm going to break and ask for questions because this is such an interesting topic. Okay, get my glasses on here. Okay, what's my opinion on off-label? Off-label, I can think that I'm reading that correctly. I am fine with off-label. A lot of drugs are used off-label. I don't need to have, as a physician, I use a lot of things that are off-label. Like I'll use low-dose naltrexone, for example, has been useful in certain autoimmune conditions. It's also can help for sleep. I use a lot of things off-label. I'm fine with it, as long as it's safe. Okay, the most important thing is safe. So if the safety profile is favorable, and I think there may be benefit, and there's nothing traditional that has been shown to be useful, I'm fine with off-label, for sure. Okay, is there a reason to use a drug if you're a healthy person or just stick to nutraceuticals? It depends on what the condition. If you're a healthy person, you shouldn't need drugs, but who's healthy? I mean, I think they've done surveys now that most people from middle age on have at least two more chronic conditions. Most people are on medications or should be. Again, if you look at the number of hypertensive in this country used to be 70,000, now it's 90,000. Then I hear it's over 100,000. Most people don't even know that they're hypertensive. We've discussed the metabolic situation in this country. Only 12% of us are metabolically healthy, which means 80% are not. So again, yes, I think if you're healthy and you're working with lifestyle, and I'm a firm advocate of nutraceuticals whenever you can, and then medications have their role when you need them. Great questions. Okay. It seems that the side effects holistically often outweigh the very specific benefits. Now, I think not quite sure I know what you mean by that question. Side effects because the side effects just holistically. Can you rephrase that question? I'll come back to it. Here's a great one. Are there any alternatives for treatment of Alzheimer's? Yes. Okay. First of all, there are two people I want you to read about if you don't already know these people. One is Dr. David Perlmutter, Pearlmutter. The other is Dr. 𝗗𝗵𝗵𝗺𝗀, Breseden. I believe he was at UCLA at one time. These are truly integrative, holistic-minded neurologists, kind of like what I do in cardiology. And Dr. Breseden just wrote a book about preventing Alzheimer's. He thinks that you can prevent Alzheimer's, and you don't wait till it's full-blown. And the problem with Alzheimer's is that it can start very early. when you talk to most people that have the disease, or you talk to their family members, they say, she started repeating herself, and I didn't really think it was much of anything. And then it can develop over a period of years, but they're all alternatives. The most important is lifestyle. First of all, exercise is so important because by increasing the blood volume by exercise, I'm talking blood volume to the brain, you keep the brain more active. So clearly exercise is one of the most important things. Another thing that is diet. And if you want to know the best diet for the brain function, I'm going to tell you it's ketogenic. And I don't have a ketogenic diet at this point in my life, but if I was having signs of early dementia, I would definitely consider it. Why? Because carbs are injurious to the brain. Carbohydrates is like it's sugar, right? Everything breaks down to sugar, and sugar adds fuel. Like I tell people, it's like adding gasoline to a fire. So sugar actually produces oxidative stress in the brain, which is the last thing you want. So what's really useful is fat, healthy fat. The brain thrives in fat. In fact, 65% of the brain is fat. So ketogenic diet is certainly something that's worthwhile to exercise. Ketogenic diet, and another thing that I like is mental activities, playing bridge, chess, crossword puzzles. They've actually done studies, people that did crossword puzzles as they age because of the mental activity involved in doing these kind of things, the focus and so forth. Another thing is like oxygen, hyperbaric oxygen. It's not approved. It is not approved to prevent Alzheimer's or dementia, but I can tell you that there's a lot of really good studies looking at the effect of hyperbaric oxygen on dementia. So again, that's a great question. And I think there are a lot of things we can be doing and we aren't. And here's why I don't really believe in drugs for Alzheimer's. And it's not just me. You go to any holistic minded doctor, they're going to say the same thing. Alzheimer's is a multi-pronged problem. It's not just because we have amyloid plaque. Like I said already, we don't know what's the chicken or the egg. How did amyloid plaque get there? I think it's because there was fire in the brain, inflammation, and then the amyloid plaque it's just like calcified plaque in the coronary arteries. It's actually protective. It helps to contain the plaque. So what happens if we start melting that away with these monoclonal antibodies? We don't know. Again, the two studies didn't really show any major benefits. So I'm very concerned about this. So, okay. I was reading that it was passed by the FDA just to keep companies doing research, that they kept turning down new meds. And you're right. I mean, how many new meds have we, this is the first weight loss drug, guys, since 2012. Okay. 2012. That's a long time to wait for a weight loss drug when you have 42% of the population obese and 70% overweight. Okay, Alzheimer's, the last Alzheimer's drug, Namenda, I think it's 18 years ago. That's a long time to go without any new meds. So I agree with the shrink shop here, is that there definitely was pressure on the FDA by Biogen. I mean, this drug really should not have been passed, should not have been approved. Sorry, but I mean, anybody that has researched this is very concerned that this was, done and again, it was fast tracked after it's already been shown to be no benefit over placebo. I mean, really, it's a very, very worrisome thing. So yes, I think there was pressure. Best supplements for weight loss. Okay, weight loss, one of my favorite topics. First of all, it's lifestyle, so you have to look at one thing I believe in. Of course, you guys know this. I'm a big fan of fasting. I do not believe it's for everyone. That's why you have to work with someone that knows what's going on. But we do too much snacking. Okay, like snacking was really big when I was competing in bodybuilding, because you're supposed to eat like 4-8 times a day because we're always burning calories. Meanwhile, it was driving my insulin levels like crazy, and I'd get moody, and I'd drop my blood sugar, and it wasn't healthy. So now the first thing I do is cut out snacking with patients, and then I try to create a window in which, okay, eat 12 hours on, 12 hours off, and then I increase that window. So fasting is important because it's not so much about what you eat, it's when you eat. And by the way, it also is very healthy for the gut. Weight loss supplements. It's really funny. I don't use that many supplements for weight loss. I do for metabolic syndrome. I do for fatty liver disease, cholesterol, blood pressure. When it comes to weight loss, it's lifestyle. It's really lifestyle. So I don't believe I can give somebody a magic supplement or a magic pill and have them lose weight, because and just like Alzheimer's, if you talk to Dr. President or promoter, we all think it's a multi-pronged disorder. So there's never going to be one drug that's going to make a difference. That's what most of us think, Okay, it's said that second only to genetics, insulin resistance is the main predictor of Alzheimer's. Definitely. Okay, so good question. So, all right, let's say you have a high carb diet. Let's say we're going back 20 years, 25 years. And so you're creating, again, high carb diet is going to break down to, it's going to be sugar, right? So sugar is going to end up in the brain. That's your fuel, right? You either have a choice of fat or sugar for fuel. And basically fat, I already told you, is a much better choice when it comes to brain fuel. So insulin resistance, when we actually, and there is insulin resistance in the brain, we have found that to be true. So if we decrease overall insulin resistance, then the body accepts your insulin. And we do it by weight loss, and we do it by supplements, and we do it by diet. So once we can break that cycle and make your body more sensitive to insulin, it involves not just the muscles, but also the brain. I think it will cut down on, definitely. Again, the first thing I would do is go low carb diet. Maybe if not ketogenic, but at least go really low carb, and that'd be the first thing. So supplements to decrease insulin resistance is very important. I have my own product called Glucose Plus, and it involves a supplement called berberine, which many of you have heard of. And actually, it's been shown in certain studies to be as effective as metformin, which is a pharmaceutical. And it's been used, when I use it with cinnamon and alpha-lipoic acid and chromium and a few other things, vanadium. And these all work together to improve insulin sensitivity. We want everybody to be insulin sensitive and not insulin resistance. Unfortunately, insulin resistant is what happens with aging, because we really don't change our diet, and we also become less active. So that's very important. Okay, doesn't this condition continue to show the human component of FDA and medical industry? When people say, follow the science, is a great example, right? FDA is human too. They make mistakes. Absolutely. I mean, FDA also has a very important role. It's our watchdog. Okay, so, and and like there's no watchdog in supplements. That's why when I tell people about supplements, I say make sure you pick a good company that has a positive record. That it should be pharmaceutical grade, which means they actually have companies coming in and looking at their supplements to see whether or not they really make the grade, because supplements are not FDA approved. They're not standardized like medications. So there's something safe about medications that we don't get with supplements. So, but there's so much politics involved. And I think that's just pretty apparent with this new Alzheimer's drug. So it's very confusing. Okay, let's see if I got all these things. We talked about insulin resistance in the brain. Good. Weight loss. Let me see. Anything else here? So if what is the goal of Alzheimer's? Okay, so if the drugs are used to basically cut down on plaque formation or maybe decrease the plaque, okay, what is that really doing? And and it's not working with what our goal is to stop the progression of the disease. Now, you might have known there are two other medications that have been around for many, many years, Aricept and Namenda. And they can help with some of the symptoms of Alzheimer's, agitation, and certain of the psychomotor symptoms that we see. They do not alter the course of the disease. Just like Parkinson's drugs do not alter the course of the disease. The disease will continue to progress because the fire within the brain and the insulin resistance in the brain is still happening. So that's the issue. We need to, if there was ever going to be a drug, it would be to prevent how to prevent the actual progression of the disease or prevent the disease from happening to begin with, which is why I suggest anybody to read Breslin's new book, Preventing Alzheimer's Disease, or Dr. Perlmutter, because I really think we can prevent a lot of the dimensions, so forth, by lifestyle. I fervently believe that. Okay, let's see. I think we talked about fast tracking and again, one of the problems I want you to keep in mind about this new drug is that once we use that monoclonal antibody to kind of like unglue the plaque, what's going to happen? We don't know. So one of the fears, and it's been shown, is that you could have swelling of the brain. Well, that doesn't sound good. And also some little punctate hemorrhages. Because remember, you've got this plaque is like containing this tangle, this neuroinflammation. So all of a sudden you release that, what's going to happen? So again, it's just, we don't know. That really frightens me. When I think about brain swelling and brain bleeding, this is like not good. It frightens the heck out of me. And actually there's a term for it. Spots of bleeding, and it's called area. Okay. And also other thing we're worried about is headaches and people falling. It's we don't really know. This drug has not been really studied that effectively to know what's going on here. So I'm pretty concerned. Let's see what else we have here. Okay. I want to make sure I got everything. We talked about off-label. Now, I guess, Trevor, you must have been the side effects of drugs outweighing the benefits, I would assume, not the nutraceuticals. Okay. I guess I think let me see if I have any questions here. We talked about alternatives. That was a great question. And again, we talked about how the new Wegovy differs from other weight loss drugs. Again, it affects the gut versus the brain, which is good and bad. That takes the emphasis off the neurotransmitters and puts the emphasis on the gut. But if the gut's not working correctly, it could actually be havoc. So the short end of all this is that there's no magic bullet out there. I think a weight loss drug could be a good adjunct, and I think we'll see how things pan out. But still, lifestyle is the ultimate with weight loss, and also and preventing progression of Alzheimer's, preventing Alzheimer's to begin with. So I think it's great to have new drugs. In my field of cardiology, there's life-saving drugs out there, but these two are, I'm a little concerned, especially the Alzheimer's one. Okay, let's see something else here. Would you say that Alzheimer's is gaining? Definitely. Well, first of all, the population is growing. Okay, so the population is growing, and yes, okay, I think I read this. I think there's like 6 or 8 million people in this country with Alzheimer's, and they expect that to like double or triple in the next few years with the baby boomer generation. We're aging now. So, it's going to be a major, and that's probably part of the political emphasis in trying to get something going, because how are we going to deal with all these people with Alzheimer's disease? There are not going to be enough nursing homes or memory care centers to really deal with all this. This is really a big problem. I mean, weight loss and declining mental decline as we age are really big, important issues. So I'm really bullish on trying to find solutions, but I have my qualms about these, and I think it's just, like you say, the obesity problem has skyrocketed. When we told people in the 90s, to go low fat and high carb, country got fatter, and diabetes became an epidemic. It was not cool. And now we're trying to change things around. And yet, a lot of people in the medical profession is still thinking, low fat, low cholesterol. In my field, I'm up against this every single day. Most of my colleagues do not feel the same way I do, and that's okay. I know what works for my patients. So anyway, okay, let me see. Is there anything else? Okay, another wonderful. Oh, thank you. Thanks so much. I enjoy these, and so if there's nothing else, we'll see you, since it's about 7:30 now. You guys can go on to your night, and I'll see you in 2 weeks, okay? So thank you very much. We'll see you soon. Thanks for joining me. Appreciate it. Okay.